Falling hair is completely normal. In fact, we lose 50 to 100 hair strands daily. And most of the time, it's meant to make way for new hair to grow. But when new hair doesn't replace what you've lost, that's when hair loss happens. It's more common to men than it is to women, but it's distressing regardless. Today, we'll talk about hair loss, why it happens, what you end up going through, treatment options, and how it can be prevented. I'm Dr. Freddy Gomez. Welcome to MedTalk Health Talk on CNN Philippines. More often than not, when we think of hair loss, we quickly associate this with male pattern baldness. But that's not always the case. Women can also experience it, and there are different reasons why we lose hair. With us today is Dr. Claudine Yap Silva. She's the head of the hair unit at St. Luke's Medical Center at the Global City. And also joining us is Dr. Romeo Bato. He's a cosmetic and hair transplant surgeon at New Heart Hair Restoration Clinic. Thank you both for joining us today on MedTalk Health Talk. Now, hair loss can either be temporary or it can be permanent. And there can be many potential causes for this. And one of the primary reasons for hair loss is that it's hereditary or napapasa, namamana. And you can be genetically predisposed to hair loss and hair thinning. Now, I'll start first with Dr. Silva. What are other possible reasons kaya for hair loss?
Aside from the ones that you mentioned, which is hereditary, so hereditary can happen in what we call androgenetic or male pattern or female pattern hair loss. But aside from that, another condition, which is alopecia areata, wherein the patients would get patches of baldness on the scalp, is also partially hereditary. Now, the other causes could be like if there is an insult to the body. So one example of this would be if the patient has had like a severe infection, like high fever. So this can cause a type of hair loss called telogen effluvium. If there is a drastic weight loss, they can also get another type of hair loss, which is telogen effluvium. Hormonal changes, like what we get in pregnancy, after the patient delivers and there's a shift in hormones, then you can get a type of hair loss also. Plus drugs, there are certain medications, not just chemotherapeutic agents, that can give you hair loss. Stress, of course, but I always tell the patients it's not just the stress from traffic, it's not that type of stress, but it has to be like a severe stress, like financial bankruptcy, loss of a loved one, something very severe. And then, of course, there are certain conditions that can give you hair loss. For example, thyroid disorders or lupus.
Okay, that's very interesting, Dr. Silva. You mentioned a lot of causes for hair loss. Now, those that you mentioned, aside from the hereditary part, are most of these on the temporary causes for hair loss? Are they more on the temporary side, maybe from an acute medical condition like what you mentioned?
Right. So for the infections, weight loss, these are temporary. Of course, the others, like if you have an associated condition, then that is, if your condition is treated or if it's progressing, then your hair loss will depend on that as well.
Now, before diagnosing hair loss, your doctor will most likely ask a few questions and maybe run a few tests. This question is for Dr. Bato. Dr. Bato, what are some of the tests na ginagawa nyo sa mga pasyente nyo to assess kung karapat-dapat sila for hair transplant surgery?
We examine thoroughly these patients. We examine the scalp to check for inflammation, redness, sores, and scarring. No? And we have to closely examine also to determine how much is being lost, no? The pattern of hair loss, whether it is hair breakage, whether it's just thinning or shedding, because these are different. No?
Hair loss can appear in many different ways, as mentioned earlier also. It can happen abruptly or it can even happen gradually. Now, this question was for Dr. Silva. What are some signs and symptoms that you could share with our viewers that may prompt them to seek medical consult already for hair loss?
Right. So you mentioned earlier, Dr. Gomez, that we lose around 50 to 100 hairs a day. So typically, if it's more than that, so sometimes I tell the patient it can go a little over 100, but if it goes beyond that, then you should seek consult. So most of the time, patients would actually notice that there is massive shedding and they would report this. Some of them actually even bring their hair shafts that they have shed to the clinic. No? So that's telogen effluvium. Now, the other one, wherein you develop a pattern type of hair loss. So for males, this is what we know as male pattern hair loss or androgenetic alopecia, wherein they present either with like a frontal hair loss over here, wherein there is like the frontal hairline goes up, or they have vertex hair loss over here. Or sometimes it can even like combine together. And then there are those who present with female pattern hair loss, wherein we lose actually this area. We call it like the Christmas tree pattern almost on the frontal area. And then we have those who present with patchy hair loss. This is what we call like alopecia areata, wherein they have bald patches of hair loss, like I mentioned, like a 1 peso coin or like a 5 peso coin. But this can also be diffuse. So they can actually have hair loss on other hair-bearing areas of the body, like your eyebrows, your lashes, and your underarm, pubic area. They can also present with loss as well. Then there are those of the scarring alopecia type, wherein they also present with patchy hair loss. But then if you look at their scalp, it's more red, it's more boggy, there is some inflammation. Tinea capitis, which is fungal infection of the scalp, of the hair, can also present with a red or a patchy hair loss that has also like some scaling. It looks dry on the area. So it really depends on the type of hair loss that you have. The patient's presentation will really depend on that.
Now, Dr. Silva, a lot of people or a lot of viewers who may be experiencing this may not go to the doctor right away. I think a lot of people who are experiencing hair loss may try to treat it by themselves for a period of time. What would you suggest for those like this? Should they take this into consideration?
You should seek consult as early as you can. Remember that, for example, for androgenetic alopecia or pattern hair loss, the earlier you start, the better your treatment outcome will be. And even for the other conditions, there are some wherein we can already give you medications or drugs to prevent it from getting worse.
All right, so if you're having falling hair and you're concerned about it, please go see your doctor and find out what's causing it so treatments can be recommended. We'll take a look at what options are available after a short break. Stay with us here on MedTalk Health Talk. Keep it right here on CNN Philippines. We're glad you could join us on the program. You're watching MedTalk Health Talk, where your health comes first. And with about 100,000 strands of hair on your head, hair shedding is natural. But if you're seeing so much of that hair on your drain or on your pillow when you wake up in the morning, we know how distressing this can be. So we're here to talk about the treatments and remedies of hair loss. First, there are factors that can make you more susceptible to hair loss. Now, I'll go first to Dr. Silva. Could you share with our viewers what are some of the risk factors for predisposing someone to hair loss?
Right. So, of course, this again depends on the type of hair loss that you have. But typically, the risk factors would include, of course, if it's hereditary, if there is a family history of the patient, if there is a significant insult to the body. As I mentioned, this can be like high fever, any infection, drugs, weight loss that is very marked or severe, certain disorders like thyroid disorders, lupus, if you have a hyperandrogenetic state, for example, if you're experiencing irregular menses, anemia, and also severe stress.
Okay. Now, when it comes to treatment, medication will likely be the first course of action. Now, still with Dr. Silva, what are some of the medications available now for hair loss?
Mm-hmm. So for hair loss or hair conditions, there are certain medications that we can give. Again, this depends on the type of hair loss that you have. So for example, if the patients have androgenetic alopecia, then typically we give either minoxidil or finasteride. Of course, you have to consult with your doctor and make sure that this is the type of condition that you have so that they can do a proper exam prior to giving you the medications. If it's alopecia areata, then there are certain topical medications or even oral medications that can be done. Another one that we give for alopecia areata would also be contact sensitization, wherein an allergen is applied so that you develop a reaction and thereby the cells that are causing the hair loss will, target the allergen instead and leave your hair be. And then, of course, if it is caused by other systemic disorders like thyroid disease, lupus, hormonal imbalance, then of course that has to be treated for your hair loss to get better.
That's great to know. Now, when it comes to side effects, doon sa dalawang medications na minention nyo, Doktora, yung minoxidil and finasteride, are there any side effects that the viewers should note of if ever they take this?
Right. So, for example, for minoxidil, typically the side effect is actually more, it's just an irritation secondary to one of its components, which is propylene glycol. Minoxidil, I'm not sure if a lot of our viewers will know this, but it started out actually as an antihypertensive medication. But this is, of course, the minoxidil that we give is a topical form already. Now, finasteride, on the other hand, does have some sexual side effects. So typically, when I give this to the patient, I warn them about it. I tell them they can have loss of libido, decrease in the amount of their ejaculate, and they should expect this. And we warn our patients, we tell our patients of the side effects to expect when starting the medications.
That's right. And sometimes these medications might not be enough to stop your hair loss, and your doctor could recommend surgical procedures. Now, Dr. Bato, what are some of the common procedures naman to treat hair loss surgically?
For surgical treatment, the only treatment that we are doing now is hair transplant. No other surgical procedure is acceptable to most of patients now. Before, we used to do scalp reduction, scalp flaps, but these are disforming surgery. So we do only hair transplant.
Okay.
But I have to add that we don't only do hair transplant, we do combination treatment. Aside from the hair transplant, we also do medical treatment, especially in young patients.
Dr. Bato, you mentioned about hair transplant as the option, as the one you go to right now when it comes to hair replacement. Now, hair transplant surgery is not a new thing. It's been around for quite some time now, but the earlier versions of hair transplant surgery, just to make it bluntly, Doctor, medyo obvious siya tignan. You could tell if a person has undergone hair transplant surgery. How is it nowadays with the latest innovations, with the many years have gone with the technique? Is it obvious now na makita sa isang pasyente na nagpa hair transplant surgery siya?
Yeah, that is true. Hair transplant has been there for several years. In the early years, hair transplant is not accepted by most of patients because of the unnatural results. Plaggy, makita mo yung mga parang mga doll's hair, yung kanyang hairline. So it's not popular during the early years. But for about 20 years now, we have started the follicular unit transplantation, which we transplant one or two or even three strands. So the results are very natural, and now patients accept the results, very natural results.
Okay, so if you're experiencing excessive hair loss, don't wait too long. And as we said earlier, consult your doctor as soon as you can. Now, what are some of the hair care do's and don'ts? We'll have them for you after a short break. Keep it here on CNN Philippines. Thank you for watching MedTalk Health Talk. I'm Dr. Freddy Gomez. Hair care is considered self-care, and there are natural ways to take care of your hair, like good hygiene. But there are also certain practices, treatments, and habits that can cause hair loss. And it's good to know the hair care do's and don'ts. Now, remember, losing 50 to 100 strands of hair a day is normal, and there are things you can do to prevent further hair loss. My first question for Dr. Silva: can you give our viewers some practical tips on how they can take care of their hair?
Right. So very practical, of course, we have to wash or shampoo our hair regularly. And I say regularly because this would actually depend on the type of hair that the patient has. So for patients who have oily scalp, I typically tell them to just do it every other day or even 3 times a week. For dry scalp, typically we tell them to just do it every other day or 3 times a week. And then for those with dry hair, with oily hair, then of course you have to wash it every day. Although now, given the pandemic, I just tell the patients to just bathe and shampoo every day just to be safe. For when you use hair conditioners, I always tell them to just use it at the tips so that it doesn't make your scalp too oily. And then when you are drying your hair after you have washed it, typically it's very brittle. So dry it very slowly. You can just pat your hair down, pat it down with a towel. And if you have to brush it, just use like a wide tooth comb. A lot of patients also do hair procedures. So for example, those who color or dye their hair, those who straighten their hair or perm or curl their hair, I tell them as much as possible to space it apart. At the very least, maybe 3 months. 6 months would be ideal, just so you let your hair rest also, because this can actually cause breakage as well.
Okay, very good advice. Now, Dr. Bato, what do you advise your patients who have undergone transplant surgery on how to take care of their new hair? Ano yung mga pwede nilang gawin? Ano yung mga hindi dapat nilang gawin?
Transplanted hairs are usually permanent. No, it does not really need any maintenance. No, you will just do your regular hair maintenance. No, but for transplanted hair, there's no special maintenance treatment.
Okay, so Dr. Bato, the hair that has been transplanted, in terms of strength, in terms of resilience, it's just as good as yung buhok nila bago pa sila nagpa-transplant.
That's true, no? Because these hairs were taken in an area at the back or the side of the head which are bald resistant. No? They are not affected by DHT. That's why when you transfer it to the balding area, they will be permanent. They will be there lifetime.
Okay. Now, for Dr. Silva, there's an increasing trend nowadays for over-the-counter self-help medications when it comes to trying to prevent hair loss. And one of these is the use of hair growth oil. Is there any evidence that hair growth oil works in starting up new hair or preventing hair loss?
Before we, evaluate something, I always like to look at what the ingredients are. I'm not very sure what's in the hair growth oil, but I would suggest that if patients would want to use it, always look at the ingredients. Now, there are many, products, many ingredients that claim to make your hair grow or make it shed less. Not all of these are scientifically studied. And even if they are, then not all of it really results to a clinically significant result. So I would just say always look at the ingredients and see if any of these ingredients have really been shown to grow hair.
How about biotin in connection with hair growth, hair stimulation, or hair care?
Right. So biotin actually, yes, that is correct. A lot of patients typically take it, as just like a preventive action, or even those who are experiencing hair loss, they take it. But in studies, actually, there's not really conflicting evidence, but more of just not significant enough to really show that it can increase hair growth. No, I want the viewers to know also that biotin deficiency is actually quite rare. Typically, you would have to have like a genetic disorder wherein you lack the enzyme. If you are on a parenteral diet, meaning those who are like on parenteral nutrition, and if you are like excessively eating raw egg whites, then those are the ones who really have biotin deficiency.
Very good. Thank you, dermatologist Dr. Claudine Yap Silva and hair transplant surgeon Dr. Romeo Bato for joining us today. We appreciate your time very much. Take the time to treat your hair with love. Remember, hair care is self-care. I'm Dr. Freddy Gomez, and thank you for watching MedTalk Health Talk, only here on CNN Philippines.